In this next module, we'll talk about screening for PEARLS eligibility. Specifically, we'll talk about how to engage new clients, how to screen for program eligibility, and how to enroll in the program if they're eligible. As a reminder, we're at the left of the flowchart after recruiting and identifying potential participants, doing the phone screening, and perhaps in-person screening as well. Let's talk in more detail about that screening and enrollment process. First, you'll want to engage new participants by introducing yourself over the phone or by video conferencing. You want to let them know how you heard about them after you introduce yourself and your organization to help build rapport. For example, you might say something like, your case manager was concerned about how you answered some of the questions about how you're feeling when you were doing your intake visit. And I'm calling to see if there's anything you need or that we can do to help. How are you doing? After you've taken a few moments to get to hear a little bit more about how the client's doing, you'll want to engage them in conversation to transition to screening. For example, can I ask you some questions to see if you can benefit from what the PEARLS program has to offer? Try not to say too much about PEARLS at this point, or it may build expectations. They may want to be in PEARLS even if they screen out or are not a good fit for the program. When screening for PEARLS eligibility, it can be done by phone, by video conferencing, and or in person. If the potential participant agrees to answer some questions, you'll basically want to administer screens to determine whether, one, they have depression, and we'll talk about the PHQ-9 or Patient Health Questionnaire 9-item and the screen for persistent depressive disorder. And two, whether they have conditions that make them ineligible. We'll talk about the screen for exclusionary conditions, as well as the brief memory and cognition screen. First, how to assess for depression. In PEARLS, you determine if the client has clinically significant depression by administering the PHQ-9 to see if they meet criteria for minor or major depression, and if not, asking the persistent depressive disorder screen, which is formerly known as dysthymia. PEARLS uses the Patient Health Questionnaire 9-item, or PHQ-9, to screen for clinically significant depressive symptoms, to find out what symptoms are bothering the potential participant. Note, you're not making a diagnosis here. You're just trying to see whether their symptoms are clinically significant to warrant treatment. We also use the PHQ-9 to monitor changes in depression symptoms over time so we can best support the participant and adjust care as needed. The PHQ-9 is also used to empower participants to learn what their depression is and isn't, and to understand what symptoms matter to them. Here's the PHQ-9 form. To meet criteria for minor or major depression, a person has to endorse either question 1 or 2, which are known as the cardinal or hallmark symptoms. These are the questions that ask about little interest or pleasure in doing things, otherwise known as anhedonia, or feeling down, sad, or hopeless, that depressed mood. In addition, they need to have at least 2 to 4 symptoms with a score of 2 or 3. One of them has to be a cardinal symptom. The others can be any others on this list to meet criteria for minor depression. For major depression, the total number of symptoms need to be 5 or more with a score of 2 or 3. Again, with at least one of those symptoms being the first or second question. Here's some tips for doing the PHQ-9. First, you can give the participant some response choice cards, which are from the PEARLS toolkit, so they have something to refer to pick the best answer that works for them. You can also use visual aids, such as this one provided by our colleagues at the AIMS Center, to help people choose an appropriate response. You also want to be neutral when asking the questions and not give any judgment based on their responses, such as, that's great. You want to read that lead-in question fully each time so they know what they're answering in terms of time frame. Specifically, how often in the last 2 weeks have you been bothered by, and then read each of those items. You can help them narrow down choices by starting with a yes/no question to see yes, no, whether they've been bothered by having little interest or pleasure doing things in the last 2 weeks. And if they say yes, you can then help them narrow it down to whether it's a 1, 2, or 3. several days, more than half the days, or nearly every day. Here's some specific tips for some of those specific items on that PHQ-9. If a client has some stigma about depression or depression care, you might ask those first two questions about loss of interest and depressed mood later on in the questions, after you've asked about sleep and energy and appetite. For the questions number 3 and 5 that ask about sleep or appetite issues, you want to specifically figure out what issue is bothering them. For example, are they sleeping too much, not enough, or having trouble staying asleep? For question 6 as well, you'll also want to get a sense of which of these descriptors resonates most. Is it that they're really feeling bad about themselves, that they're a failure, or that they've let themselves or their family down? This will help you get to know the client as well as more accurately be able to get a PHQ-9 score and understand how clinically significant their depression is. For question 7, this is about trouble concentrating. This question isn't trouble with memory. It's really more about whether they're able to focus on things. So you may have to help clients distinguish between the two. Question 8 has a lot packed in there. So it may be helpful to pause. For example, reading, moving or speaking so slowly that someone else could notice, or being fidgety or more restless than usual. That helps break up the sentence. And if you get 2 different scores, make sure to use the score that's the highest. For question 9, which asks about suicidal ideation, specifically about how often in the last 2 weeks someone has had thoughts they'd be better off dead or harming themselves, we will cover what to do if someone responds with a 1, 2, or 3 in the suicide and self-harm module. For now, you're going to include how they respond to question 9 in their total PHQ-9 score. If the client meets that criteria for minor or major depression with the PHQ-9, you then want to administer the screen for exclusionary conditions and the brief memory and cognitive screen to determine if they are eligible. Some organizations also use a cutoff score for the PHQ-9 to indicate minor or major depression, such as greater than or equal to 6 or greater than or equal to 10. If they don't meet criteria for clinical depression using the PHQ-9, you'll want to then administer the screen for persistent depressive disorder. This is a screen for a form of chronic depression that used to be called dysthymia. A person may be eligible for PEARLS if they answer a yes to question 1 or 1A on this screen. In that case, you'll then proceed to the screen for exclusionary conditions. If they answer no to both 1 and 1A, let them know that PEARLS is not a good fit for them, as they don't appear to have clinically significant depression. We'll talk later in the module about how to talk with them about other resources. Next, let's talk about screening for exclusionary conditions. Conditions that exclude a client from PEARLS include psychosis, schizophrenia, bipolar disorder, substance abuse or alcoholism, and cognitive impairment. Note that a client may still be eligible for PEARLS if their condition is not active or functionally impairing. We recommend consulting with your clinical supervisor before making a determination about eligibility for these clients. This screen will determine whether a potential client is functionally impaired by the presence of psychosis, bipolar, and/or alcoholism or other substance abuse. In the past, we would automatically screen people out of PEARLS if they had a diagnosis or were taking a medication for these conditions. However, we recommend you work with your clinical supervisor to assess whether a client may be eligible for PEARLS if they're not functionally impaired and can actively participate in PEARLS sessions. For example, can they keep appointments, conduct a problem-solving treatment worksheet, and work on their homework and action plan? If somebody does not screen out with that exclusionary condition screen, you'll then want to ask the brief 6-item memory cognition screen to determine whether somebody has memory and other cognitive impairment. For this screen, if somebody has a score greater than or equal to 3, that suggests that they are negative for significant impairment and they're eligible for the PEARLS program. If their score is less than 3, it means that they screen positive for cognitive impairment and they meet our exclusionary criteria. So they're not a good fit for the PEARLS program. Thinking about screening by phone, we recommend using whatever is accessible for the client. If they can use video conferencing, you may need to provide some brief orientation, but people have been able to do screening by just phone alone in the past. We recommend, if possible, you mail or drop off the materials beforehand, including those response cards for each screen. It'll make it easier for both of you to complete the forms by phone. And make sure you both have a private space to talk if possible, as some of these items may be sensitive for clients. Try and allow more time for rapport building before screening, especially if doing by phone, as this is going to be your first time meeting the client. And you may need to break up screening with the first or baseline Pearl session into different phone calls. It can be a lot to answer all these questions by phone. So follow the client's lead. Lastly, do provide other coping and other resources as needed, depending on how the client's feeling after filling out these questions. Remember, administer these tools by following instructions on the form. Really focus on whether a client is functionally impaired by the conditions they are managing or whether there's somebody who could potentially participate in the program, and discuss whether someone's appropriate with your clinical supervisor to make the best call. After screening, if the client shows they're eligible, you'll then describe the PEARLS program to see if they're interested, and if yes, review the appropriate forms to enroll them. If the client screening shows they're not eligible, let them know that PEARLS would not be a good fit for them based on the information gathered. And have other options that you can discuss with them that'll better suit their needs and resources. In terms of what's next, for enrollment, you'll have a consent or release form to fill out. If possible, have a letter that you can give their primary care and mental health provider if they give permission to release that information. That way you can provide coordinated care over the course of the program. Many organizations also collect demographic information to understand who they're reaching and not reaching. In the toolkit, we have an example of this in the participant information form. We also have a baseline questionnaire, which collects information about the client's level of physical, social, and pleasant activity, as well as self-rated health when they start the program. And then you can ask them those same questions at the end to see whether those changed over time. Lastly, you'll want to administer other forms as required by the organization.